happens. So all you gotta do is pray and God will get you through it. And that next year is left unpregnant with twins. So keep your head up. God always has a smile on his face no matter what happened.
That's an example of managing effective cognitive, like managing his thoughts. I came this close to being a Marine. This close. Like I went with the recruiter and everything. And at the last minute, because I didn't have money for college anymore. I was going into my third year. And I remember I was like, I'm going to the Marines. Like I had decided. And then I had a summer job in Chicago. And I used to always take a shortcut through this college. And it was a college it was a liberal arts school, and we did about radio and television, which was my major. And I was like, there's no way I'm gonna be able to enroll in this college because their semester was about to start in 4 weeks. I was like, there's no way I'm gonna be able to get in and get financial aid because I need financial aid. I mean, there's no way, it's only 4 weeks. I said, you know what? I'm gonna go for it. And if I get into this school and get financial aid in 4 weeks, I won't join the Marines. I got in. I was like, how? Like I had to get my transcripts, like all of that happened in 4 weeks. And so I guess it wasn't meant to be for me. Because I was like, there's no way I'm gonna get all that paperwork done in time. So we're gonna go through humanistic therapy. I'm sorry for the side route thing, that's just fascinating. It is Veterans Day. Let's go through humanistic treatment and then we'll make the announcements that I didn't make at the beginning and then we'll be done. Humanistic therapy is which we mentioned humanistic before, but the therapy is where underlying rationale is that people have control of their behavior. They can make choices about their lives. They're responsible for solving their own problems. You can kind of consider humanistic therapy positive motivational therapy. A therapist who's using these type of techniques, they're going to be encouraging the person. You can get through this. You can overcome this. Sometimes if I use this type of intervention, I may have a person tell me about some of the challenges you've overcome in your life. And then they'll tell me, well, yeah, there was this and I got through that. I want them to start seeing that they were able to overcome, work through, go through something difficult. And so this, what they're doing right now, they can do the same for that. I'm helping them to realize that you have control, you can make choices, you can get through this. That's the humanistic approach. You got this. So because some people, I'm gonna tell you right now, we've all get down on ourselves, but everybody in this room has overcome something difficult. Everybody. I don't care if it's something family related, relationship related, job related. We've all had to overcome something. Give yourself credit for doing it. Give yourself credit for having the strength and the resiliency to push through. Don't just dismiss that. Some people couldn't get through what you went through. Give yourself some credit. And so you've been through something difficult before, and you can do it again. Some people were like, man, I'm almost about to fail this class, but you pushed through. Oh, I didn't think I was going to graduate, but you graduated. My heart was broken. I didn't think that pain would ever end, but it did. So, humanistic therapy, you can have control. All right. Nope. We'll stop there. Okay. Announcements that I didn't make earlier. I sent an email out yesterday for an announcement. Hopefully everybody saw it. If you did not, I will review some of the important things that it said. It mentioned that normally on the schedule or the syllabus, today would have been test 4. There is no test 4 because I eliminated it. That's why we didn't have it today.
It's by December.
So that test 4 will be your final, which will be on December the 2nd. Now, because we eliminated test 4, the final will cover 4 different chapters. I'm still gonna keep it 40 questions. So basically, each chapter is gonna cover about 10 questions. Chapter 11, health psychology. Chapter 12, psychological disorders. Chapter 13, treatment of psychological disorders. And the final chapter, chapter 14, is social psychology, which we'll be going over next time. So it'll be about 10 questions per chapter, and they'll all be on the final. Also, speaking of the final Any of you have missed the final, at this point, you have to wait until we take the final, and then you can make up a test that you missed. Decide your option. But as I said many times, the bulk of your grade is about the quizzes. I hope you completed, there was some quizzes that were due yesterday. Hope you ever did. I did mention that in the email as well. There is now only one more set of quizzes that remain. That's it. And it'll be for chapter 13, treatment of psychological disorders and social psychology. Those quizzes are due on December the 1st. So that's the day before your final, that Monday. Those are your last and final quizzes for the semester. You will be done. So make sure you go ahead and get that done. You don't have to do it right now, but you have until December 1st. I should also mention, because I didn't set up the system, if you missed a date, like if you're like, oh, I forgot to do those quizzes for yesterday, you can do them if you want. Unfortunately, you don't get any credit for it. It's past the deadline. It's not how I designed it. I mean, I didn't design it, so that's the way the school set up. So if you just want to do it to give you the experience or learn the information or see what you know, that is absolutely fine. But that's why I spent the entire semester, every class, reminding you when the quizzes are due. Not some days, every day I remind you about the quizzes. I tell you which ones are due. I tell you when they're due, every class. So, it's a big part of your grade, so I would advise you, make sure you finish strong and do these last set of quizzes. I believe that's all I need to tell you. I know Saeed had mentioned earlier, asking if we were going to do a review. My intention is to do a big review activity the last day of class. That's what I'm kind of doing quickly so that we can do the reviews. I have two things in mind. I won't tell you what they are, but one of them is a game, one of them is a group activity. So hopefully we have time to do that. We'll just have to wait and see. Any questions about anything I just said? All right. Well then, you are free to leave. Enjoy the rest of your Tuesday. And I will hopefully see you all on Thursday.